So, regarding the courses, we have some of you will be joining our regular batch. In the regular batch, RB is a regular batch. So usually classes are done on the weekends. Usually, most of the places we do on weekends. And here we have a detailed teaching of the subjects. And whatever subject we finish this week, we take a class test next week. Okay, but somehow you will be joining our test and discussion batch where we do weekly tests and discussion. What we call tests and this T&D in short we write. This was the regular batch. This is a test and discussion that we do in some of the centers, not in all the centers. Some centers, especially in Delhi, Bombay, we are doing, and perhaps we may like to do in other centers. Here we do weekly test of 1 hour, and followed by discussion for 6 discussion or one subject, of course, and we do discussion for 6 to 7 hours. But most of the places, regular batch we are doing in all the centers. So detailed study of all subjects we do, detailed study of all 19 subjects, or this also all 19 subjects we do. All 19 subjects, all 19 subjects. So 1 hour test, one subject, followed by discussion for 6 to 7 hours. What we do. Now, how we really teach? What is our pattern of studies? Let's pattern study. All faculty are given standing instructions to cover frequently asked questions, latest questions which have come in the recent exams. We cover a lot of recent advances, which are the highlight, plus some controversial questions, confusing questions, and there are some questions whose answer is not known to anybody, which are known as prize-winning question. In all the subjects, we cover a lot of basics. Our basic has to be very, very strong, and our faculty give you a lot of basic concept. Like today, when I taught you ECG, I started from very basic, what the ECG paper is, what are the timing, everything we discussed. Then only you can go to the top of the world. Your basics should be very, very strong. If your basics are not strong, you can never go to the height. You can never reach the creamy layer among the first 5,000 students to get a branch and college of your choice. Okay, this is what we talk about the courses, regular batch, and test and discussion. Now, come, which books? So, I hope things are clear to you. The next question is, I can rub it out. Which books you have to read? Well, friends, there are plenty of books are available in the market. You talk to your seniors. First question, you like in medicine, should we read Harrison or not? Okay. Your seniors say, oh, without reading Harrison, you can never clear the exam. and the same question is asked to me, I say reading Harrison is absolutely contraindicated. Why? But sir, our senior says without reading Harrison you can never clear your PG. I say I'm much senior to your seniors also. The student I have been teaching for years together now, many of them have become professors and head of departments of various colleges. I'm very proud to say that my first student was Dr. Vikas Malhotra. He is the professor of ENT in Maulana Azad Medical College in Delhi. Okay, most of your professor or highly praised faculties have been my students all over country, because I have a huge experience of teaching more than 1.25 lakh students. Now, why I say reading Harrison is contraindicated? If you read Harrison, there are 20 pages on ECG, and reading one page of Harrison, just reading Harrison, you need half an hour. Only reading per page half an hour. To understand, you need 2 hours. That means you need 2.5 hours to read one page and understand Harrison one page. And there are 20 pages. You need 50 hours to read an ECG. And do not forget, you need only 2 minutes to forget to whole page. So suppose you have come to attend my ECG class, your other friend, he say, oh, I study at home. So he needs 50 hours to finish ECG and you have done in 25 minutes, revise in 3 minutes. His is hard work, yours is smart work. So reading Harrison is contraindicated. So now, which book should read? Well, again you go to seniors, you read this and popular book, they will talk about all the subject. You go and in the market you buy, every popular book in the market is, there are 1,000 plus pages. Cost of this book is again 1,000 plus rupees. Can you read this huge books, voluminous book? And the only question bank, it's the only question bank with expert answer, textbook is not there. If you have to read 19 book like any popular book of medicine, surgery, PSM, pharma, etc., etc. Every even small subject they have written huge books. And one more unfortunate, most of the books are written by not the subject teacher. Not the subject teacher. If there is one person who writes all the books, obviously, the person whose subject is not there, he can never write the book, quality book. So we understood this point. So we have come up with the complete series. So we have come with the books, so-called complete series. Complete series we have launched. They are the concise. They are the concise book. Crisp, to the point, written by the subject faculty. Subject faculty contain all latest questions which have come in the recent exam. LQ, they will write them. All recent exam questions are there. All controversial, recent ones, and they contain all recent advances. And all are kids. None of them is very voluminous. Okay. So that's the complete series we have come up. You read these questions. Read our series. This is published by us, our own. This is from Dr. Bhatia Medical Institute only. You read these books. You find things are so your concept, and of course, this bigger point is they contain both notes and question bank. They contain both notes as well as question bank. At one place, that's why we have given the name as complete series there. You will not get better than these books. Read these books. Complete series. You have text material followed by the question, relevant question which have come in the recent exam, which you will not get anywhere in any other book. So friends, you need something crisp, concise, easily palatable. You read this series of the books. That's the ultimate. Okay, that's the ultimate. Right, sir? So what books to read? So if I have to conclude the today's session, what to read, what not to read, how to read, remember, teach, and one more thing, we have the excellent faculties to teach you. We have, our faculty is excellent of all 19 subjects. That's why for the last 10 years, all top rankers in all the major exams from our institute. Others call it a miracle. For us, it's just a routine activity. Friends, Arjuns are not born. Arjunas are not born, they are made, they are created. This country does not lack in people who want to become Arjunas. You don't get Dronacharyas. We are proud to announce that our is the premier most institute. We have the best faculty of all 19